And I pay Hajia Shiraz Elminchain, or Health Promotion Officer Emma East Municipal Hospital at Menino Edin Komo, would also be joined by a gender activist Elizabeth Ofori Elmediano so Anape. But Hajia Elminchan pay at Menino Edi and Komo. Hajia, good morning.
Good morning, my brother.
I'm hoping you're doing well.
Yes, please.
But you're Trina, yeah, and I say suspect.
it's not. I'm not fluent.
Okay, all right. Then let's stay with the English language. So, is it really an issue like that? This sanitary pad issue, is it really an issue like that?
Yes, it is. It's a very big issue, and if you observe in the past years, a lot of NGOs are focusing their attention on it based on the severity of the nature. So indeed, it's a big issue that needs to be looked at.
Let's look at the role that these sanitary pads play in the lives of women. What role does it play?
Okay, so as you know, every growing child or every growing female child gets to a stage where menses begin. And when these menses begin, that is a point you need to take very good care of yourself, hygienically, physically, and everything that has to do with it. Now, the dangers associated with the menstruation is that if it's not handled very well, it can lead to certain disease conditions that may bring complications. Some of the complications are it can cause problems to your reproductive system when it comes to childbirth. So these are some of the things we want to avoid, and we put much focus and much education on the menstrual hygiene issue.
Do women necessarily have to use pads? I'm asking this on the basis of the accounts, you know, we've had growing up, where our sisters and our mothers used to use, some of them used towel, some of them used cloth when they were having their menses. Do women necessarily have to use pads?
Not necessarily, but like I mentioned in my earlier explanation, the whole menstrual thing, if not handled well, would lead to certain complications. And you know, menstruation is involuntary. God, in his own wisdom and nature, created a woman and gave us menstruation. It's not by our choice to menstruate or not. So, like you mentioned, in the past there were no sanitary pads and women were still menstruating and handling it well. But you realize that the incidence of reproductive diseases, diseases related to the female reproductive system, were high before the introduction of sanitary pads. So after the introduction of sanitary pads, some of these cases came down. So research found out that the use of the rags and other things were not healthy. Why? Because maintenance of it was not well done. How to wash and dry it, how to keep it clean till the next menses was not, the education was not going down well. And so some of these girls and women were suffering from it. But the introduction of sanitary pad, the sanitary pad is disposable. It's not reusable. So once it is used, you dispose it. So there is no kind of, it doesn't kind of causes infection or reinfection. So that is why the sanitary pad is most recommended as far as menstruation is concerned.
Now, the usability, or should I say reusability of the menstrual, you know, the pads, the sanitary pads, is where my concern lies. Because if over this period where you've done the advocacy, where you've been hammering that it was relevant for the 20% tax on these products be removed to allow for these young ones or even the elderly to have access to these pads, if government is not hearing, it's not about time that you, the advocates, switch the conversation to proper hygienic ways of maintaining or using these ones that our mothers used to use. Because yesterday, for instance, I was having this sort of conversation with my colleague who was here with me, Fatih, and I was telling her that, okay, so let's say you have a tissue, a thick tissue, and you know that when your flow comes, it's thick day one, and then let's say day two, but after day two, it's a little bit light. Then day one, make sure you have about 3 handkerchiefs with you. Not the normal handkerchiefs,
Yes.
but the other ones, the woolen ones.
Sure.
So that's for day one and day two. You know that you're educated, and so when you get to the house, this is going straight into hot water with some Dettol or something to ensure that it's clean. Is that not what we should be preaching now?
So when you look at the things we use for the menstruation, apart from the pad, like days gone by, we used to use racks. Now, these kind of racks are made from different kind of things. We have racks that are made from cotton, others that are made from nylon, and others that are like, it looks more like plastic. And when it comes to menstruation, you need to use a kind of material that is very absorbent, that can absorb the blood well, and when washed, it will be nicely washed, or everything that it has absorbed would go. Looking at the pad, that is what the pad is made of. The level of absorption is very high compared to other materials. And now, the previous ones we were using, like the rack, sometimes if it's not well washed and reused, like I said initially, you can imagine the dangers that is likely to occur. The debris or whatever that has retained in the pad is likely to get back into your reproductive system as a woman. And this can cause a lot of health effects.
The health effect, I'm
Yes.
interested in that.
Okay.
I'll bring you back to the old ways of
That's
doing it, and
fine.
whether preaching proper hygienic maintenance of these clothes
Yes.
isn't a way we should be looking at. But what are the conditions that are likely to affect a young lady or even an adult if the person uses the normal rack system or the normal cloth
That is what
system?
I'm saying. It depends on the type of rag you are using. Okay, the kind of rag, if it is made of cotton, and your hygiene, your level of hygiene is good. It's not. We don't discourage that. Okay, because our mothers have used it, our grandparents have used it. We don't discourage that, but in situation where you don't know the right material to use, that is where the problem comes. And in this day and time, you and I know, even the textiles, the cloths we buy, it has become very expensive. So nobody would want to buy a new cloth and use it, like tear it into pieces for her menstrual period. A lot of the time we use old cloth or worn out cloth, and some of the time the level of the cloth being worn out, you see that the level of absorption is low.
Colorants, yeah,
Yes,
even
and before you realize, some of these girls, when they use it, in some few hours they swell themselves. And others who don't know much about menstrual cycle or anything about menses, especially the opposite sex, they tend to tease them, and
Now,
it's very embarrassing.
how much is a pad now? How much is it?
Well, depends on the brand. We have different kinds of pads. There are some you can get as much as 20 cedis.
Okay.
I know a brand of pad that is sold at 40 cedis.
Okay.
And so far, the cheapest I have come across is 15 cedis.
Cheapest is
Yes,
15 cedis.
that I have seen. I don't
Okay.
know if there are others cheaper than that, but that's I have seen is 15 cedis.
You are a woman. How easy or difficult is it to cough that 20 cedis to buy? It's a monthly thing, right?
Yes.
To buy that, every month. How many pieces would a woman need every month?
So the number of pieces depends on the amount of flow.
Okay.
We have different women who have different kinds of flow. The flow starts from little to moderate and to heavy. So if you are someone whose flow is light, at least 2 packets of a pad will be enough for you. So if you are using the as low as 15 cedis one, you will need 2 of it. That will be 30 cedis. And because you change the pad after some time, okay, you can't use one pad for 24 hours. If you are someone who has a light flow, you can use like 4 pad. Maybe every 6 hours you change. Every 6 hours you change. So you can imagine if the pad has the maximum I've seen is 12 pieces, and that's 24. And some of us do flow from 1 to 7 days. So if you are using 4 pad in a day by 7, that's around 28. So even if the pad has 12 in it, 2 of it is 24.
Yeah.
So that means that it may not even be enough. You need an extra pad.
Now, we are looking at this conversation with most of the times the eye of the capitals,
That's
the regional capitals. I'm sure you would have gone to some, outskirts, deprived areas What's the story there?
The story there is that the access, sometimes not the affordability, but the access to the pad
Okay.
is not there at all.
You can't get pads to buy.
Yes, there are some remote areas that's getting the pad even is difficult. And there are some areas the pad is there, but the affordability, the money you would need to buy the pad is not there. So these are some of the situations. So in those areas that there is no access to the pad, we as health workers are trying as much as possible. Some of them, we call them hard to reach areas. So the pad doesn't get there because of the proximity where they find themselves. But as much as possible, we try in our outreach services to introduce this pads to them. And sometimes we have some NGOs who are ready to donate. So as health workers, we collaborate with some of the NGOs who are ready to donate. And you know, these things, because of the high cost of the pad, it doesn't come always. It's once in a blue moon. So as and when we as health workers collaborate with the NGOs and we get hold of it, then we take it to this few hard to reach areas. But like you said, if we are able to take it there, they use and it gets finished, and we don't get any sponsorship or any donors giving us the pad, then they are back to square one.
Prior to this conversation, I was reading lots and lots of articles about how this is impacting on the education of young girls because of the stigma of soiling their dresses, the infection rate, and sometimes even being lured by people who would say they will provide pads for you and they end up taking advantage of them.
That's true.
How real are these situations in the hard-to-reach areas?
It's very real. It's very real because, like I mentioned earlier, the few pads we get to take there to the hard-to-reach area, when they get to use it, they feel comfortable using the pad compared to what they were using before. Now, in the absence of the pad, whoever that promised them that do this for me or I'll do this for you and give you a pad, the fellow would preferably want to comply just to get the pad. Yes, so that is what happens, and it's a very big challenge. We try as much as possible to do our health education to prevent some of these things, but it's difficult because they have used the pad, they have seen the advantage of the pad, they have seen how comfortable the pad is, how absorbent the pad is, how it's able to prevent them from one disease or the other, and they like it, they want it. So whichever way they would do to get it, they will do it. So anyone that promises them, oh, come do this for me, or let me do this to you so that I can provide a pad for you, ignorantly, they agree. And before you realize, they're in one trouble or the other.
I hear governments, not just this administration, talk about, oh, we'll provide free meals, oh, we'll provide computer, oh, we'll provide that. Should it be one of the basic things government should be thinking about, to provide these sanitary pads for girls at a certain level within our educational system? Let's say from the basic to, let's say, the SHS level. Should it be a thought that should have hit somebody by now? Yes,
it should. It should, and it's very important. However, my fear or concern is that it should be channeled to the less privileged. Okay, there are places where people can afford, but when such a thing is introduced, you see that we will abuse it. Even those who can afford would want to take it for free, and that is where the challenge is going to be.
But you're saying those who can afford, but even you, for the working class, it's not affordable to you.
So like I said, depend on the brand and the quantity of flow. So like you are saying, it's very important for government to give it a thought, because the previous panel who were here, the lady mentioned that to menstruate is not a choice. It's natural.
Yeah.
If we had a way, we would have stopped it, and we also live like men. But this is something we have no control over, and we have to pay or bear the costs for what is happening to us naturally. Do you understand? So I think, by all means, there should be a way around it, where even if government makes it free or even affordable, like everybody, whether you can afford or not, everybody would benefit from it in one way or the other.
Because I'm thinking about, you know, let's say they go for 3 months
Okay.
for a term, and every school knows the number of girls in that school. And so government says that per your, example you gave me, that let's say the 15 city one, you're going to use 2 every month. So times 3, that makes 6. So
Okay.
every girl child is required to be provided some 6 pieces for the
month.
for the term
Okay.
that they are going to be in school.
Yeah.
Regardless of you being in a deprived area or not, this is a necessity.
Yes.
Otherwise, if the issue about some people being able to afford comes in, then the luxuriness also pops up.
That's true.
So,
So let me come in here. You see, days ago, one of the NGOs known as MYO means my future, your future, our future. They chose one school in Dodowa to donate sanitary pads to them. I was part of them. I was the guest speaker who gave health education on menstrual hygiene. And when it came to the distribution of the pads, the teachers spoke to the people and told them that if you know you are not menstruating, don't take the sanitary pad because you are going to waste it. And some of the comments that came for the non-menstruating ladies were like, their mothers and sisters are menstruating, so they are going to take it for them.
wow. Wow.
And the motive for this was to keep them in school because some of them absented themselves from school because they didn't have a pad. So this program was specifically designed for school-going children. But the school-going children, those who were not in their menses or who hadn't gotten to, who hadn't started menstruating, they were insisting to take it. And reason were that they were going to give it to their mothers and sisters who menstruate. So these are some of the challenges I'm talking about. If only we as human beings would be fair, then we'll make things easy for the government. But with some of these challenges, it's going to be very difficult. And I think that is the fear and that is the reason that is holding some people, or let me say political leaders, from either bringing down the taxes or making it affordable and free for some of the less privileged, because we are going to abuse it.
Interesting. Now, would anybody be fair to describe a sanitary pad as a luxury?
No, that's very unfair.
Why not? Because you have alternatives.
Yes, but the advantages of using the sanitary pad outweighs the rest of the alternative. And where I come from, I believe in prevention. Prevention is better than cure. Okay, sanitary pad, in the history of, from the introduction till now, there is nowhere in history that sanitary pad have caused any problem to a menstruating child. But with the issue of the rags and other alternative, we have records of such unhygienic use of something to absorb the menstrual flow. In the hospital, there are records of such, but nowhere have we ever recorded that a sanitary pad has given someone any health condition or any complication.
Your advocacy, it seems not to be garnering the kind of attention that it should get. Have you wondered why that is the case? It's not just you, but there are several NGOs out there. There are several female politicians. There are several male politicians who have advocated for the removal of this 20% tax on these sanitary pads. Why is it not getting a hearing?
That is something we are also, for now, surprised about, because we expect that by now we should get results and we are not getting. So, as the saying goes, Rome was not built in a day. We are hoping someday. So we are not relenting on our advocacy. We'll keep on trying and trying till we get the results that we want.
If you send your petitions and if you engage the powers that be, what do they tell you about their unwillingness to remove the tax? Do they give you some reasons as to why they don't?
Well, so far, per the people I have had or communicated with, they haven't specifically put it that they are unwilling. The response we get is that they will look into it, they will look into it, they will look into it. That is why I say we are not relenting. if maybe they had voluntarily come out to specifically tell us that we are not going to do this, then maybe we would have found other alternative. But the fact that the feedback we are getting is that they will look into it. We are hoping that someday the results we want will be gotten.
In the end, it is Parliament that is going to sit, or Parliament that sits to debate on these issues and then approve, and then it's assented to by His Excellency the President.
That's right.
Have you been to Parliament themselves, and what are they telling you?
So me, as a professional, a health promotion officer, I personally haven't joined any organization to go to Parliament, but I know that some NGOs have gone. And to be honest, I haven't heard the feedback from the Parliament. Personally, I haven't been to Parliament, but the NGOs who have gone, we are waiting and hoping to see that we'll get a positive response. Till now, Parliament haven't said anything about it, but it's an issue that is pending at Parliament, and we hope that they will come up with the right response that we need.
All right, if you just join us, you're welcome. We're talking about sanitary pads. Fact that there is some 20%, tax on it. There is some 13% tax on it, VAT, and the advocacy for these taxes to be removed, because the advocates say that these taxes must not be there. These are essentials. Sanitary pads should be described as essentials to fall under the category of essential goods for ladies, women, students to enjoy these sanitary pads without buying them at the exorbitant prices. One more etono, one from Fanchemen. And here, Daniel Waba, a bank competition, because there's a lot more to cover about a commodity. A month for experiences, and some April.